Welcome back. South Korea is experiencing a fresh wave of COVID-19 with daily caseloads hovering above 70,000 in recent days. Now, the Yoon administration has pledged a scientific approach to addressing the latest rebound. And for more on that, I have Professor David Kwak from Soon Chun Hyang University. Professor Kwak, welcome back.
Good afternoon. Thanks for having me.
I also have Professor Lee Hoon Sang from Yonsei University. Professor Lee, it's been a while. It's good to have you here.
Oh, yeah. Thank you for having me today.
Right. Professor Kwak, do you believe the resurgence here in South Korea came earlier than expected? And if so, how do you explain this trend?
Well, I actually personally don't think it's earlier than what was expected. If we actually trace back the graphs of daily confirmation cases all the way back to the beginning of the year, the last huge wave that peaked in around the mid-March of time actually started going up probably in the early January. And we're roughly hitting about the 6th month from that point of time. And so thinking about the possibilities of waning of immunity from the vaccinations and also natural infections, it was already expected that we could see the waning happening in about 3 months to possibly even 6 months of time. So it is not something that's completely out of the ordinary or expectation what we are seeing. However, the speed of the transmission that we're about to see in the near future might be different from what we have seen from the past wave, because as we see the BA5 and namely the BA 2.75, the speed of their transmission is completely different from what happened with the Omicron variant of COVID-19. So I personally anticipate that this particular wave that we're going to go into might be a little shorter lived and also possibly even smaller in amplitude, and I'm hoping, than what we've experienced with Omicron, primarily because of the differences in the transmission speed, but also due to the fact that we probably gained a huge portion of immunity from the natural infection and also the high vaccination rate that we've gained probably in the last 6 months or so.
Right, and keeping in mind what Professor Kwak has said, Professor E, when do you suppose will this new wave or fresh wave peak? Authorities are talking about like cases, the daily tally surpassing 100,000 in the very near future.
So it is always a little bit, I would be a little bit cautious about predicting something, but I think according to a number of modeling studies, I think we are actually, expecting that the number of cases, per daily cases will go up to 100,000 cases sometime in August, and possibly sometime in September, it might go up to 200,000 cases. And according to some of the modeling studies, some studies suggest that it might well go up to about 280,000 cases by end of September. But it really depends on many of the situations. If the people will take more of the precaution because of the developing situation, then things can be different than what we have predicted. So we will have to see how it falls out.
Right. Professor Kwak, in response to this latest rebound, as mentioned during our news segment, authorities are banning in-person visits to nursing facilities and other vulnerable venues. What are your thoughts on this measure, and what perhaps more can be done to better protect the vulnerable groups here in the country?
Right. So it's not something completely new again that we're taking this measure. It's obviously to protect the more vulnerable people who are currently contained in nursing homes, and also immunologically more weakened people who might be stationed in hospitals and whatnot. It's the least amount of measure that we can currently take to minimize possible mortality and morbidity in people, because it's already clearly known that people who are much elderly, who are above 60 years of age, and also people with much weakened immunity are more prone to getting COVID-19 more severely and also possibly dying from it. So the mode of, if we want to prevent further transmission and also try to minimize such mortality and morbidity, it's physically logical to come up with an idea to actually block transmission, possible transmissions going into those certain group of people. So that's the measure I think the government is taking. Another huge step that we can take towards such measure is obviously vaccination. With a 9% roughly rate of a population having been inoculated with their fourth shot, the second booster, I believe it can reach even higher numbers, especially among elderly generations and people who would be more prone to getting it severe. So I think by promoting the benefits that we can gain from having them receive fourth shots for their own safety, I think we'll be able to reach much higher protection against this new wave of the COVID-19.
Right. Professor, testing centres are also being expanded to accommodate the surge in cases, and authorities are also looking to allocate more hospital beds for COVID-19 patients. Do you believe these efforts will be enough to help us endure this latest wave, or do we need more stringent containment efforts?
Well, again, I would always be very careful about what will be enough for responding to the cases. But I think having some of the more enough surplus beds to respond to the situation, I think will not be a bad idea. But I think what will be important is, as Professor Kwak said, it will be very important to have people, elderly populations over the age of 60 years old, and also people with underlying conditions to be inoculated with the fourth shot, the second booster shots. And also, especially for the people with compromised immunity, they should be, we have to really encourage them to get the vaccination. So what will be important is for general populations, I think it is just the general precaution of the basic hygiene practice. But it will be just very important to protect the vulnerable populations.
Right, of course. Professor Kwak, now, as you mentioned, vaccine-induced immunity is waning, but healthy adults under the age of 50 are currently not eligible for second booster shots. Why is that the case, do you think?
Well, it's closely related to what we've just been talking about. It's the fact that once we go beyond the age of, let's say, 55 to 60, the mortality rate and the morbidity rate jumps greatly from compared to the much younger generation. So people who are elderly, and also, as Dr. Lee also mentioned, people with lower immunity and who are more prone to severe, they are the specific groups that needs much more specified and special care and attention in regards to COVID-19, as opposed to the much healthier and younger generations. If we were to say, let's say, a person in 40s without any underlying diseases, he or she would be much more likely to have COVID-19 symptoms much more mildly, if not completely going through asymptomatic. I am also currently seeing in my own clinic that a lot of people, huge numbers of people are coming in to be checked for COVID-19 possibilities, but they are also at the same time showing much lighter symptoms. But the stories differ for much elderly generations because some of them could be stationed in hospitals, some of them could be admitted in nursing homes. Their stories are completely different from what we are usually seeing in a regular clinical hospital. So that's probably the reason why currently the government is mandating only those 50 and above, and also less than 50 who are with strong underlying diseases to be inoculated. But it still does not mean the second booster shot will benefit those who are inoculated. So I think in general sense, we should still promote the general education of idea to get the fourth shot for all the population instead of the just specific groups. But we should obviously encourage more that the more vulnerable people should go ahead and receive their second booster shot.
Right, which makes sense. Professor, staying with COVID-19 inoculation, recent reports show that menstrual cycle is affected by COVID-19 vaccination. Could you tell us a bit more about this? And is this a cause for concern, do you think?
Well, actually, as for the changes in the menstruation cycle, also sometimes there is a greater amount of menstruations it has been reported to happen around the world and also in Korea as well. As for why this is happening, it is a little bit unknown yet. So there is not enough established science about which explain about this. But there is some speculations about why this might happen. But as for the possible reasons, the experts are saying that the menstruation is a little bit like the immunological reaction process. So where some of the speculation is firstly, if people are vaccinated, it can stimulate immunological reaction naturally to boost the antibody formulation. In the process, maybe it might affect some of the menstruation process. And some other speculation is maybe the stress because of the vaccinations, because they are worrying about vaccination, maybe they can affect it. And there are some other possible causes. But I think the established opinion is, the consensus is, it is something not too much to worry about. And usually this kind of effect will go away after about 2 months, after 2 menstruation cycles. So I think it is not too much of a concern as of yet. But if there is any but there can be some coincidental situations of this change in menstruation cycle at the time of vaccination, like endometriosis or some other gynecological conditions. So if there is any change in the menstruation cycle, and especially if there is a more amount of the menstruation, then it will be just good to consult with a gynecologist or medical experts.
Right, I see. Professor Kwak, do you believe, broadly speaking that is, that COVID-19 has strengthened perhaps our ability, South Korea's ability, to better deal with future pandemics? I mean, are there any other areas perhaps that we could further improve?
Well, I think I personally think that Dr. Lee could be more specialized in this regard because he's just an expertise or expert in this regard. But one monumental achievement that I remember that we've achieved in the past through the pandemic is the fact that we came up with our own vaccine, namely the SK Biosciences vaccine against COVID-19. It's not only monumental in the fact that we have another tool, but it's the fact that we're now able to manufacture our own tool of fighting against this particular disease. And through the process of establishment, I think we've also gained a lot of knowledge on how to prepare for other possible infectious diseases. So I think we've gained knowledge and experience and also the manufacturing capability and also our own design of a vaccine that we'll be able to utilize to fight against possible other infectious diseases in the future. I believe what can also be done is probably screening for false information in the media if we haven't learned enough yet. So for the future, I think we could do a better job as a whole population in the nation to really screen out the false information and only rely on what's right, what's beneficial, and really follow the logical way of protection or protecting ourselves against any sorts of infectious diseases, that is.
Right, that is true, of course. Professor, beyond the pandemic then, severe acute hepatitis of unknown causes in children continue to be reported. What are your thoughts on this?
So there had been some of the hepatitis cases that had been reported in more than 35 countries with resulting more than 10,000 cases of hepatitis, severe acute hepatitis in children. Especially that had been happening in a lot in UK and Europe, and also it is now happening. It had been happening in United States, and some of the speculation is that it might be caused by the adenovirus, and one of the explanations that had been suggested is that maybe some of the COVID-19 infections that had happened to some of those children might have put the children somewhat more vulnerable for the adenovirus because there had been some of the study which found that 28% of those acute severe hepatitis children were confirmed to be having previous COVID-19 infections, and 38% of them had been found to have COVID-19 antibodies. So there is some speculation that maybe some possible correlation between the previous infection of the COVID-19 and this vulnerability of the adenovirus infection which might have resulted in severe acute hepatitis.
Right, and it's still just a speculation.
Oh, sure.
Yeah.
But
Professor Kwak, are there any precautions then that parents need to take, or are there any symptoms that they need to be aware of with regard to this severe acute hepatitis in children?
Well, let me begin by listing the possible symptoms that could represent the severe hepatitis in children. They would obviously come up with very common symptoms such as fever, fatigue, tiredness, usual chilling sensation, and muscle ache and whatnot. But a couple of two very symptomatic or specific symptoms that are related to hepatitis is a symptom of pale stool. So a person's stool is not as dark as usual, it's very light and it's kind of floating in the water. That could be suspected. And also what's called jaundice. It's the yellowing of the eyeballs or even our skin that shows the reducing function in the liver, which could be a sign of hepatitis. So those are some of the things that we could look for in observing possibilities of hepatitis in children. But what we can do to actually prevent it is common sense. As Dr. Lee also mentioned, keeping personal hygienic measures, such as washing our hands all the time, and obviously taking shower every day, and also not going into a very close contact with other people in social gathering situations. Also, boiling and cooking food very thoroughly before consumption. Those are the common sense measures that we can take to prevent any sorts of transmitting viruses such as hepatitis, because these viruses, such as the hepatitis A type B and C, and also possibly with adenovirus, they transmit through droplets or fluids, which can be eradicated with high temperature cooking.
Right, I see. And back on the pandemic front, Professor, what are your words of advice to our audience members as we fight this fresh wave of COVID-19?
As for the advice, I always start with saying that there is just no silver bullet. And I think we have to just go back to the normal precautions, just basic personal hygiene. But I think wearing mask is still very important. And also because we are in the situation that where the transmission is happening at a high volume. So it's still, I think, very, it will be still advisable to avoid, if possible, too much of a large gathering, if possible. But I think what will be more important is to protect the more the vulnerable population, people over the age of 60 years old, and as I said before, people with compromised immunity. It is really important to have them inoculated with a full shot of vaccines. But I think one of the things that we can remember is as for the mask, what had been found with this COVID-19 infection was that the preventive effect of wearing mask can be even greater when the person with the infection is wearing the mask. So I think the general precaution of the wearing mask and washing hands for the general public, I think is still somewhat advisable. But if you think you have some of the symptoms, even though you are not confirmed for after the testing, I think not only for protecting yourself, but to protect others, I think it will be very important to make sure that you wear the mask.
Right, and staying with that, Professor Kwak, perhaps we could end with your words of advice to the public.
Well, I would like to continue with what Dr. Lee was saying. Let's keep the common sense in keeping the personal hygienic measures. We've experienced enough times that our own protection from keeping the personal hygiene have protected us from reaching even higher numbers. When we wash our hands, when we wear our mask, and when we keep the certain distances, it does help us survive through this pandemic. So let's keep those three measures.
Right. Do you suppose a quarantine day of 7 days is enough, or can we shorten that particular time frame?
I have actually no thought, a specific thought in regards to that, but I think currently 7 days is okay, minus the fact that if a person, there are very minor groups of people who actually show to be able to transmit to others after 7 days of quarantine. So I think if a certain group of person or people are suspected of continuous infection, they should not just check themselves once with PCR testing, but possibly with second or third times of RT-PCR testing even afterwards the quarantine period.
Right, just to be careful, of course, then. All right, Professor Kwak, as always, thank you very much for your time and your insights. And Professor Lee, thank you for being with us today.
Thank you.